This video is about how to prevent Parkinson's disease. It's from my book right here, Prevent and Reverse Parkinson's Disease by me, Pete Rogers, page 341. I got a whole bunch of other videos from chapters in this book on here. So here's a picture of the brain. This is a midline sagittal view. And the substantia nigra is located in the midbrain. This is this part of the brainstem right here. Beneath it is the pons. There's the medulla. There's the cervical spinal cord. There's these two little black stripes. Substantia nigra means stuff black, so the black stuff. Okay, normally it's black on the brain, and these neurons are highly concentrated in the neurotransmitter dopamine. If you look at the neurotransmitters in the brain, dopamine is only about 1% of neurotransmitters, but it's concentrated right here. Normally it has a little bit of a back tail, looks like a swallow. With Parkinson's, that gets rounded off. That's one of the MRI findings, but it's not that helpful. Sometimes we'll see it, but it's not that helpful. Okay, the important thing to know is you got to protect your dopamine-producing neurons in your midbrain. Okay, so now let's talk about what damages them and what you can do to avoid that. Typically, a person has to lose about 60% of their substantia nigra neurons before they get symptoms of Parkinson's. So by the time you know you have it, you've already lost 60% of those neurons. There's about 400,000 of them total in the substantia nigra. So, and each one can have like 1 million synapses to other neurons. So what you want to do, a lot of times it's mitochondrial toxins that damage those neurons. So you really want to avoid anything toxic to mitochondria. Okay. You know, in the Bible it says fear of God is the beginning of wisdom. Well, protecting your dopamine producing neurons and their mitochondria in the midbrain. That's the beginning of wisdom with Parkinson's disease. Okay, so you can imagine these neurons, they're going to burn through tons of energy. And over 90% of your energy comes from your mitochondria. It's really good for making ATP. ATP is like a $20 bill in a cell, adenosine triphosphate. Okay, dopamine neurons, depending on which papers you read, they'll have anywhere from thousands of mitochondria to as many as 2 million mitochondria in one cell, because it can have connections all over the place. All right, and these mitochondria, they're little intracellular organelles. They look like a little peanut. They've got an inner and an outer membrane. And they crank on energy production. Okay, lots of the chemicals you'll have heard about, like MPTP, and trichloroethylene, they're all mitochondrial toxins, okay? So, you know, I'm a person who figured out there's about over 120 mitochondrial toxins, and I've written about this extensively. I've given lectures on this extensively, the role of mitochondria in disease, okay? I've also gave a recent lecture, why do microglia eat brain cells? Microglia are the guard cells of the brain macrophages, part of the immune system. When a cell gets low on energy, they eat it. They remove it before it bursts, because if it bursts, it'll leak its contents out, and that'll cause a lot of inflammation, which will damage the surrounding cells. So just when a cell starts getting low on energy, boom, they remove it, they eat it. So the point is, you don't want your cells to get low on energy, or they'll get removed. And how do you protect your cells from getting low on energy? All the things that make the rest of your body healthy. Get your healthy diet, low fat, low sodium vegan, exercise, avoid stress, avoid. Now, caffeine's controversial. If you look at the standard books, they're going to tell you caffeine's good. I don't believe it, because it's a stimulant and it's also a hypoxicant. It's going to drop blood flow to the brain. Okay, we're going to start going through these because a lot of these are really common. Okay, there's a lot of brain diseases that are associated with mitochondrial damage. You know, diabetes, cancer, excitotoxicity, cognitive decline, Parkinson's disease, ALS. ALS means amyotrophic lateral sclerosis. That's also called Lou Gehrig's disease. And you can't change the past. You can't change what you were exposed to in the past. But there's a lot of things people don't think about that could be related to Parkinson's. For example, dental amalgams. You got those mercury, those silver, they call them silver fillings. They're really 50% mercury. And you have bidirectional veins in your face that are shared with the brain. Okay, and they could potentially be a source of mercury toxicity to your brain, because mercury can cross the blood-brain barrier. The dental amalgams outgas, meaning that the mercury comes out of the amalgams, and they are thought to be able to travel back to the brain. So if you got early Parkinson's, you might want to consider having your amalgams removed to reduce that exposure to mercury. Okay. Oh, but there's a ton more stuff. We're just getting warmed up. Okay, I'll probably have to make 2 videos. Okay, so just to give you a little perspective on mitochondrial inhibitors, I knew they had to be important because I had read about them here and there in different, papers on disease. And then I decided to go to my biochem books. I had considered being a biochemist, so I own like 7 biochemistry books, including a good nutritional biochemistry book. The best one's by Gropper, Gropper, Gropper. Anyways, nothing on mitochondrial inhibitors. I knew there was tons more than that. So I went through all the literature. I found over 120 of them. And here's just, some of the common ones. Look at this, saturated fat, that's a big one. That's what causes diabetes, type 2 diabetes. A lot of heavy metals, things like iron, excess iron when you're iron overloaded. Zinc, excess zinc. Aluminum, excess copper. Excess cadmium. Lead, not good. Excess chromium, okay? A lot of stuff on non-organic foods. Here is the glyphosate. They spray that on non-organic soy. They also spray it on 70 other non-organic foods. That's why I only eat organic. If you're worried about Parkinson, you got early Parkinson's, you want to go organic. You also want to filter your water. Fluoride is also a mitochondrial toxin. Fluoride and aluminum are routinely present in tap water. They put fluoride in intentionally, and aluminum is a so-called clarifier. It binds things to it. It also forms a complex with fluoride that facilitates traversal across the blood-brain barrier. In general, fluoride is added to a lot of medications like these neuropsychiatric medicines for treatment of depression and other psychiatric conditions because it binds tightly to stuff. It's a halogen, and it increases their traversal of the blood-brain barrier. The problem is it's also neurotoxic, and so is aluminum. So that's bad to have in your tap water. That's why always filter your tap water with reverse osmosis. Okay, if you're eating any fried food, you don't want to do that. Not one more bite the rest of your life. Omega-6 oils have a metabolic product of these lipid peroxidation reactions as a toxic aldehyde called HNE, hydroxynonenal. Hydroxynonenal is a very powerful toxic aldehyde that gets into the brain, and it will inhibit mitochondria. It also damages lysosomes and can destroy brain cells. So you don't ever want to take another bite of fried food, and you don't want to be eating any oils. Don't eat any food with oil in it, and forget about olive oil. Olive oil is for chumps. It also contains a lot of omega-6 oils and a lot of sat fat. That's 2 mitochondria inhibitors in your Evo extra virgin olive oil. It's just a BS name to make it sound like a virgin bride. It's nonsense. Okay, a lot of common medications are mitochondria inhibitors. Like I just had a friend, he told me one of his friends had severe back pain, so they were taking a lot of Tylenol and NSAIDs, like ibuprofen. I said, brilliant. Tylenol is a mitochondrial inhibitor, acetaminophen, and so are non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen and all that stuff. Aspirin is an uncoupler of the inner mitochondrial membrane. Bad, bad, bad. You don't want to mess up your mitochondria. You drop that energy production too low, microglia become activated. Remove that brain cell. You don't want that. A lot of antibiotics are mitochondrial inhibitors, fluoroquinolones, beta-lactams, aminoglycosides, tetracyclines. A lot of cardiac drugs are mitochondrial inhibitors, beta blockers, statins. These are really common drugs. A lot of your neuropsychiatric drugs are mitochondrial inhibitors, like your selective serotonin reuptake inhibitors, like Prozac, sertraline, okay? And some of your tricyclic antidepressants are also mitochondrial inhibitors. Not good. Never eat processed food. Ultra-processed food, it's usually going to have an antifungal in there, anti-mold. They don't want mold growing in the food. It can sit on the shelf for a long time. Well, guess what? Those are typically mitochondrial inhibitors, succinate dehydrogenase inhibitors, complex 2 of the inner mitochondrial membrane. You don't want that, okay? People ask me, why am I so obsessive-compulsive about eating careful? Because I'm afraid. I don't want mitochondrial inhibition, brain damage from this stuff. Some supplements will contain cyanide in them, mitochondrial inhibitor. Some almonds, okay, and some flax. I don't eat that stuff. Potentially it can be a side effect related to some of these coatings they put on avocados, for example. The AP, then you know what comes next, the next couple of letters, EEL. I won't ever eat that stuff. There's a whole bunch of them. So the best way, you're going to end up wanting to become a minimalist. Just eat a couple simple, whole, organic foods. Okay. Exercise helps too. Exercise gets you to sleep better. Don't be drinking any alcohol, not one more sip, if you want to optimize your brain health. Okay. Avoid anything that causes head trauma. That's bad for your brain cells. So anyways, that's not even all of them. Non-organic food also is going to have atrazine. I mentioned glyphosate, I think. There's a lot of these drugs. Don't ever smoke marijuana. It's a major cause of brain damage. It doesn't deserve all the people who tell you it's good for you. They don't know what they're talking about. I had to deal with a lot of people with brain damage from marijuana. It's a very bad drug. Okay, metformin. That's a very common drug for treatment of diabetes. So you see, lots of these common drugs are damaging the mitochondria. Arachidonic acid. That's another reason to avoid meat. That's a lot more common in meat. Okay, so anyways, there's a bunch of mitochondrial inhibitors. I got a whole bunch more lectures on mitochondrial inhibitors, and I got a good lecture on them over at VegSource if you want to see that. Okay, Parkinson's disease was first described in London in 1817 by Dr. Parkinson, and it was thought related to the Industrial Revolution, all these new chemicals coming into London, and some of them made people sick. Forget about genetics. Hardly anything is genetic. Usually when something is thought to be positive family history, it's not because it's genetic. It's because they all eat the same food or they're all exposed to the same toxins. There are some mutations that increase the risk of Parkinson's, but that's seldom is that the cause, okay? Very good neurologist, researcher of Parkinson by the name of Alberto Espe. He wrote a book about it. And he thinks the whole proteinopathy thing is totally exaggerated. And he says that Parkinson patients often have autopsies that are very similar to Alzheimer's. And you're going to see senile plaques, neurofibrillary, senile plaques extracellular, neurofibrillary tangles intracellular. You're going to see them in both patients very commonly. He also says normal people often have Lewy bodies at autopsy. Okay, so that's sort of the Lewy body dementia, end-stage Parkinson. And what Espe is really saying is he thinks that these Lewy bodies and these senile plaques, instead of being like the cause of the neurologic disease, he thinks they're like a tombstone. They're just found located next to the dead neurons. An important point to be aware of is that substantia nigra neurons, dopamine-producing cells, they've got glucose type 4 transporters. These are typically called GLUT4s. The relevance is GLUT4s are affected by insulin resistance. So high-fat diets, like especially high-saturated fat diets, they're going to cause insulin resistance. They're going to drop the energy delivery to these neurons because they won't be able to get as much glucose into them because of the insulin resistance. So you don't want to be eating high-fat diets. You can be starving in the midst of plenty. You don't want that, okay? And there's a lot, atherosclerosis contributes, but it doesn't have to be atherosclerosis. You can see young patients with atherosclerosis, and that's often, I think, due to a chemical that causes mitochondrial damage. Okay, that's what I think most likely happened to him. Just to know about it, you can get neurogenesis in the substantia nigra. Neuron, genesis, to make new. You can get the formation of new neurons in the substantia nigra. Exercise will help with that. Maybe reading and things like that will help. Make sure you get your sleep too, lower your stress level. All of that increases neurogenesis. Exercise can also lead to mitochondrial biogenesis, the formation of new mitochondria. And it's been shown to help patients with Parkinson's. They got to exercise at the level they're ready for, but it can help. Okay, levodopa is a medication. It's a precursor, and it's really sort of a standard treatment for Parkinson's. L-DOPA, but it doesn't slow the progression of the disease, so it can cause symptomatic improvement, but it doesn't relieve the disease. Okay. Carbidopa increases the amount that gets into the brain. Excessive dietary protein can inhibit L-DOPA transport into the brain, so a lower protein diet can help get L-DOPA into the brain. I'm just going to show you a picture here about the Brock theory of Parkinson's. So the Brock theory was that toxins in your food and your water can spread to the brain via the vagus nerve from the intestinal tract up to the brain. So the vagus is called the wandering nerve, like a vagabond, and it innervates the gut. Okay. And there is some supporting evidence for that. If you cut the vagus nerve, vagotomy, patients are less likely to get Parkinson's. And they've been able to inject synuclein protein into the gut wall and have it travel to the brain. The Johns Hopkins researchers did that. Okay, now I'm going to show you the other theory of Parkinson's disease. The other big one is the Borghammer theory. He's a Danish guy, the Great Dane, Borghammer. And the Danish doctor says that he thinks that Parkinson's tends to start more commonly in the nose by inhalation. It gets into cranial nerve 2, the optic nerve, or cranial nerve 1. Shit, I forgot. It's been a while since I thought about that. The optic nerve, the olfactory nerve. Olfactory nerve is a nerve of smell, okay? And it goes straight from the olfactory nerve. You can tell I prepare a lot for these lectures. I just come home from work and I just make the lecture. I wrote this book months ago. Okay. Anyways, the olfactory nerve, it'll travel right to the brain. And that's another reason why you don't want to be using deodorant. The worst is a spray-on, okay? Because it'll travel right up to that olfactory nerve to the brain. And that's thought to be a route to cause Parkinson's disease as well. And it's also thought to cause other types of brain damage. So you don't want anything that smells bad, you should avoid it, okay, for different reasons, okay? Volatile organic chemicals can cause circuit inhibition, which is bad for the brain. They can increase your risk of autoimmune disease. The aluminum in deodorants is thought to cause brain damage when you inhale it, so you never want to do that, okay? Anyways, that's the Borghammer theory. Okay, and they both can be right. All right, I'm going to make that the end of part 1 on Parkinson's disease. I hope you found that helpful. I'll be coming back with at least one more, maybe 2 more parts on this series.